Just a recent example of that was we had a lady that needed to go in and get a carpal tunnel release, right? Like just a really basic surgery. And Medicare reimburses, I think it was like $5,800 or something like that. And yet at the same time, the facility, the hospital, where unfortunately she was one that was originally had been referred into a hospital setting for this procedure, they wanted to charge $60,000, right? They wanted to charge more than 10 times Medicare, and tried to get us to sign a single case agreement that was, not a single case agreement, that was an agreement for anything done at that facility for the next 12 months after that event was going to take place. So luckily, in her case, we were able to get that rerouted. Even if we paid, let's say would have paid them $12,000, which would have been twice Medicare. At that point, they're still making a good amount of money, but to charge 10 times more than Medicare just seems totally egregious. And I think anybody would say, geez, that's beyond the scope. That's totally unnecessary. But unfortunately, that's something that we see those kinds of instances so often, and a lot of times it's hard to believe, because most people think, well, geez, if for any other transaction, if I pay more, I'm going to get something of higher quality. And in healthcare, a lot of times it's the opposite. And that's the other thing I failed to mention was this facility for carpal tunnel releases. As we started to look into it, the doctor she was going to go to was not highly rated, right? This was a guy who's got a lot of revision surgeries. So can you imagine having a carpal tunnel release, total cost of that being $60,000, and then having to go back in because of a mistake or an infection or who knows what, right? Whereas we know outside of the hospital setting, at those outpatient surgery centers, that they're going to get better quality care. They're going to get their issue addressed. And a lot of times too, these bundles you're talking about, they've got some of those contingencies kind of baked into that too. So if this happens, right, if we get in there and find this complication or this problem, they've already solved for that, right? They already have an idea of, look, this isn't going to cost you more. You're not going to feel as though you're nickel and dimed when we've got you open on the operating table, right? So it's kind of interesting to see how that shift in people's perceptions, and that's where I think a tool like HealthMe is great, and where any medical management vendor is great, because they're able to help kind of make this simple for the patient, for the end user, to the point that they can feel confident that they're getting the best quality care. And if they're working with us or others that are building plans the way we are, then they're also getting that care at no out-of-pocket cost. I mean, it's that, you said it, there's a triple win. It's the win-win-win. It's completely possible.